very vital topic called cochlear implants, rehabilitation issues. Cochlear implants is the boon of modern science to the 21st century for children who have got severe hearing impairment of 75 dB and above, and also to the adults who have lost their hearing. With the surgical advancement and technological advancement, otologists, that is the ENT surgeon, and the neurological surgeons have been able to do a lot of work by doing a surgical procedure called cochlear implant surgery, thereby giving the scope for the child to once again hear the sound. So when the cochlear implant surgery is being done, the best age range for a cochlear implant surgery is from 8 months onwards, basically, when there is bilateral severe hearing loss or hearing loss above 75 to 80 dB, where normal hearing aids don't help the child to acquire the speech, because hearing is very much fundamental for acquiring the speech and the language development. So the earlier staging of the cochlear implant is done, the better are the result, and preferably so below the age of 3 years, because afterwards the critical ages will have crossed. After doing the cochlear implant surgery, the child is fitted with the necessary processors, and the surgical procedure is done. The implant electrodes are inside the cochlea, and then the tuning takes place for the cochlear implant. After the tuning takes place for the cochlear implant, the child starts to hear the sounds, but we are more concerned about the listening activities of the child. Hence, there is a new technology called cochlear implant rehabilitation, called cochlear habilitator and speech station. This cochlear habilitator uses the tonotonicity of the cochlea and produces the sounds in such a way that the entire frequency range of the cochlea is stimulated, along with other listening skills. These listening skills, if done on a regular basis, will enhance the capacity of the cochlear implant and make the cochlear implant or the hearing aid functional for the child to acquire speech and language. Afterwards, there are a lot of other technologies which are associated with the cochlear implant habilitator, like producing the sounds, going into the voice modulation, phonemic perception. There is also the articulatory and the voice modulation that are very much essential, and this is a part of the complete cochlear implant rehabilitation program called cochlear habilitator. So the training has to be done both in the clinic, and parents can also use it at home as a home training program, which is very much essential because most of the time the child stays at home. So this company has introduced a version for the parents called Home Edition, where the parents can be trained how to use the cochlear implant at home. So this, coupled with the speech pathologist references and the speech pathologist advice and supervision, will help the cochlear implant child to integrate himself very soon into a normal school by continuous therapy and applications. Thank you.